This is the normal heart. So as you can see, heart is having 4 chambers, and this one is the ventricle, which is on the left side, left ventricle. This is on the right side, right ventricle, and it is placed in the body like this. The upper portion is the right atria, and on the back here is the left atria, and these are the 2 great vessels. So one vessel going like this, it is the main aorta. It's the main vessel which is coming out of the left ventricle, and another vessel is going like this and spliced with 2 branches on the lung. So this is the normal heart. Now we will tell what will happen when there is a congenital heart defect known as a VSD. VSD is the ventricular septal defect. As the name telling, these are the 2 ventricles, right ventricle and the left ventricle, and there is a wall which is separating both these ventricles so that the oxygenated or a pure blood will not mix with the non-oxygenated or unoxygenated or a blue color or a bad blood. So that wall is there which separate both of these things. When there is a hole, it is usually a congenital hole at the time of the birth only. So during the development of the fetus in the mother's womb, there is a defect in the wall known as a VSD, ventricular septal defect. So when there is a communication between this ventricle and this ventricle, left to right ventricle, the defect is known as a ventricular septal defect. As you can see, if we open the heart like this is the left side of the ventricle, this is the right side of the ventricle, and the defect is here in this wall. So as you can see the wall here, the defect is between these 2 ventricles. What happens when the left ventricle pumps the blood goes in the aorta and some blood goes through that hole into the right side, and there is a mixing of the valve. The blood gets mixed, the pure blood gets mixed with the unpure blood, and the blood from here will go to the pulmonary vasculature, that is causing the increased pulmonary blood flow. Usually this defect is asymptomatic, and it can be picked up with a very harsh murmur. The murmur is a sound which a cardiologist picks up by keeping the stethoscope over the chest, and more small is the size of the defect, more harsh the murmur is. And this defect, if it is a small in size, usually there is no need, and it depends upon how much is the size and where is the location. Usually these defects close as the child grows on, but if the defect is a large one and it is in a certain area which is having no tendency to close, it can be closed either with the interventional known as a device closure or with the surgical technique. So surgical technique is a very common technique. It's a very common congenital heart malformation in which the Dacron closure or a patch closure of this defect is done. Usually the patient is taken on a cardiopulmonary bypass, and this right atria is opened, and through the tricuspid valve we see the defect. We close the defect from here only and close it and come out of the bypass. To do this operation, heart-lung machine is required, and a bypass circuit is required. So it is a simple heart disease to be tackled by surgery, and after the tackling of the disease well advanced in the early age only, the chances of survival and the longevity of the patient is quite okay. And if it is ignored and if the defect is long standing in first or second decade, there is a tendency of getting the pulmonary artery dilated, and the grade that blood pressure in this vessel known as the pulmonary artery hypertension increases, and it goes towards eastern syndrome, and where this treatment is not possible, surgical treatment is not possible, and the life expectancy becomes low. So this is a congenital heart disease which is known as a acyanotic heart disease, very common congenital defect with the hole in the heart, and the patient should come to the surgeon for the treatment, and the treatment is quite simple and easy, and it can be done in any center which is having a heart-lung machine, and the cardiac surgery program is going on. Thank you very much.
I remember when we were staring a photo. Don't forget the way you look me in the eyes, and I keep you in my heart. In my heart is where you are. I still think of you, I want you coming back. I remember when we were staring a photo. Don't forget the way you look me in the eyes, and I keep you in my heart. In my heart is where you are. I still think of you, I want you coming back. you can take